The United States of America. We pay nearly twice as much for our healthcare system as any other industrialized country, and yet we live shorter, less healthy lives. We're one of the wealthiest nations to ever exist, yet our healthcare system leaves over 26 million uninsured and many times more underinsured, resulting in around 500,000 bankruptcies related to medical bills every year. We need Medicare for all, and we need it everywhere. Medicare is a public health insurance plan from the federal government. It covers elderly Americans after they turn 65. It's what's called single-payer healthcare, a kind of healthcare system where most doctors and hospitals operate as private practices, but instead of billing you, the patient, they bill the government, making the government the single payer of healthcare expenses. It currently covers over 62 million people, it's more cost-effective than most private health insurance plans, and it's one of the most popular forms of healthcare coverage in the United States. National Improved Medicare for All is the proposal that we create a universal, single-payer healthcare system in the United States by expanding Medicare to cover things like hearing, dental, prescription drugs, and more, while lowering the age requirement from 65 down to, 0. Healthcare isn't just for the elderly, or the wealthy, or the employed. It should be guaranteed for all. We've been fighting for it for decades, but how do we win? In Canada, the province of Saskatchewan became the spark of a healthcare revolution when it became the first to pass a single-payer healthcare system called Medicare. That system was eventually expanded to cover everyone in Canada. In the United States, we have a similar story for our own healthcare system. The Affordable Care Act was based on a statewide plan that had previously been implemented in Massachusetts, demonstrating the incredible influence states have over federal policy. In the US, we have movements for single-payer healthcare in many states, from the ballot initiative campaigns in Washington, Oregon, Colorado, and Maine, to legislative campaigns like CalCare and the New York Health Act. Single-payer advocates are fighting all over the country to make healthcare free and universal, but for the most part, they have operated in individual silos rather than as a mass movement. That's what got us thinking, what about joining these movements into a national coalition? What if we raised money together so that we could develop movements in every state? What if our organizers worked across state lines? What if we marched together in solidarity every year? If we combine our efforts, one state just might break through and pass a statewide version of Medicare for all. And from there, it will spread and spread until we have Medicare for all everywhere. We are an aspiring coalition working to unite single-payer campaigns in every U.S. state, territory, and district behind a bottom-up mass movement for Medicare for all everywhere. We demand healthcare justice at every level of government. Follow us on Twitter at M4A_everywhere, or go to MedicareForAllEverywhere.org to learn more, sign up to volunteer, or make a tax-deductible donation.